Hello, everybody, and welcome to the AFC Policy Fireside Chat. My name is Kim Hunt. I'm Executive Director of Pride Action Tank, which is a project incubator and think tank on LGBTQ issues that lives under AFC. And there I also serve as a Senior Director of Policy and Advocacy Operations. This is our second fireside chat. The first one got rave reviews from what we understand, as much as you can measure that these days. And so we're bringing it back because we know there's just so much going on in the ether around policy at all levels, and we want to use this time to break it down. So I am thrilled to be joined by my colleagues, Aisha Davis, who's the Director of Policy at AFC, and Timothy Jackson, although he has Tim on his name tag today, who is the Director of Government Relations. And we are part of the Policy and Advocacy team at AFC. So we've got lots to go over, just like we did last time. We've got five big topics. We're going to talk about the census. We're going to talk about updates at the federal, state, and local level also. But before we do that, I wanted to take a moment of silence in honor of Walter Wallace Jr., yet another person killed by police, Black man. So let's just take a moment of silence for that. Ashe. Thank you so much for that. All right, everybody take a deep breath because we're going to get into it. First thing we're going to talk about is the census. It was on, it was off, it was off, it was on, it's off again. Tim, what is happening with the census?
Look, let me tell you, the census was kind of like a on again, off again boyfriend or girlfriend. It's just like you never knew what was coming or going. Unfortunately, the census has wrapped up as of October the 15th. The state of Illinois did okay. We registered about a 71.4% self-response rate for the state. We registered about 70.5% in 2010. So had a little uptick, which is okay. We would have preferred that higher, but that's kind of what we're working with in a global pandemic. The Cook County had 67.4%, while the city of Chicago had 60.9% self-response rate. And so, kind of what we talk about, the on again, off again, there was the confusion surrounding that, but there is no confusion that how important census data is. It is so important about really using those population numbers, those tabulations, when it comes to funding for communities, planning services for public transportation, skills training for employment, public safety, education, family services, and the list goes on and on and on. And so we understand how crucial that is. Also, we know, based on the Constitution, that the numbers gained from the census are used to redraw the congressional lines as well as the state legislative district lines. And so that process will take place next year once the official numbers come in. And so finally, those same population numbers are used to determine the number of congressional representatives the state of Illinois has, and the total number of electoral college votes the state currently has. Right now, the state of Illinois has 20 electoral votes. It's 2 for our 2 United States senators and the 18 that we have in the United States House. By all indications, Illinois is set to lose at least 1, possibly 2. And so what that looks like, determining, how our numbers look, the final numbers look, we could look at right now in 2020 that the state of Illinois will have 20 electoral votes on next Tuesday. In 2030, that could look like possibly 18 or 19. 2024 rather, moving forward. So it's a big deal. So thank you to everyone who filled out your census.
Yes, indeed.
Yeah.
Clearly, there's a lot at stake as we think about next week. We know that folks have already started voting, obviously, but next Tuesday is election day,
Yeah.
so next less than a week away. You mentioned redistricting as something that's at stake, even though the deadline for the census is passed. The decision on how that happens has not happened yet, and there's much more to talk about. So let's move to voting. And everybody, come on now, this is our power. Some of us are in tears, ready to cry because of all the things going on, but this is our power. Let's this is one form of power, so let's talk about it.
Okay. So one thing that
Yeah.
one thing we've been talking about, and honestly, I know that Tim is going to take the lead on this section, but I have to say that
Yeah.
when we've been talking about voting in this like season of voting, it's not just about election day. The resounding chorus has been make a plan. And I have to really nod to Tim on that one, because he's been saying it every day for I don't know how many days. You have to make a plan. So Tim, tell us about making a plan.
Yeah, thank you, Aisha, for setting that up. You are spot on. What we're looking at right now, yesterday, the United States hit 50% of the total number of people that voted in 2016 have already voted in early voting. That is ridiculous, how that looks like. And so when we talk about making a plan, what does that look like? Here in Illinois, you have a few different ways to vote. You can vote by mail. I'm going to be honest with you. If you have not already done so and already submitted your ballot back in, if you have your ballot at home, we encourage you to mail it in. There have reports about the Postal Service and the lag. What I would encourage you to do is, if you do have a ballot that you already have, that you filled out and everything is sealed up, what I would encourage you to do is to drop it off at an early voting site. And those are located, and I'll talk about those in just a moment. And you can do that. There's no postage. You don't even have to put postage on it because it's going directly to elected officials. And so that's what I would do. So the voting by mail, which has been very popular here in Illinois. You also have early voting. And so when we talk about early voting, what does that say? And a lot of people may think, well, this is some new kind of thing. Not really. You may have heard of absentee voting. That's the same thing. Or if you here in Chicago, Cook County, Illinois, you can go to an early voting site and vote, register to vote and vote on that same day. So voters who participate in early voting must vote in person at assigned early voting location. Here in Chicago, though, any early voting site, which is huge. So say like I live on the north end of town, but I work in the Loop. If the Loop location is closer to where you work, go to that one. That way you'll be assured of getting there. Especially make sure you check your hours and locations before you visit. That information is so crucial to understand. We know that all of those early voting locations are now open across the state of Illinois as of October the 19th, and will be so up until Election Day, including weekends. So that's important to remember. Always remember to take your government issued ID. It is not required, but when I talk about making a plan, I want you to make a plan. Take it with you, and you may not even need it. It's better to have it and not need it than to need it and don't have it. And so make sure you take it. Make sure you take, and again, making a plan. Take something that has your physical address on it. So that could be something from ComEd, your electric bill. Something where it is your name and your address. Again, you may not need it. You probably won't. but it's, again, better to have it. And then we get into election day voting. If you are not comfortable, some people have expressed that they don't really know about the voting by mail, and I get it. And if you've not been able to do early voting, there will be election day voting as normal. Again, you would need to go to your home precinct in order to do that. You will, however, you will be able to register to vote and vote on the same day for election day. Just, again, make sure you have some ID, that you bring something that includes your home address on it, the address where you're registering to vote, and then be prepared to stand in some very long lines. When I talk about making that plan includes, if you're going early morning, take your breakfast with you. Take your lunch with you. Take a snack. If you're someone that needs your medications during the day, take those. Take you a couple of pills with you. Take you some bottled water or something to drink. If you can't stand in a long line for a very long time, take you a little fold-up chair. Like a little tailgate chair. For my people, I'm originally from the South. It may be a bit warmer. Take you a fan. It's going to be colder here in Illinois. Bring your jacket or maybe a blanket. Again, make a plan, because we're going to be looking at very, very long lines, like I talked about at the outset. So many people around the country are voting. We're seeing huge numbers here in Illinois that are voting, which is awesome. We love to see that. But we want you to understand to be prepared and go about being prepared and making that plan. And so, again, you have up until election day to register to vote and vote in person. And so I think those are all of the points I have.
I was going to say, I want to add one thing. So what we're hearing about these long lines and the delays, and Tim is absolutely right. So take food, take water, take medication if you need it. But we also have to recognize that this is also a form of voter disenfranchisement, right? So having these delays and having these very long lines means that folks who don't have the luxury, right, of being able to even wait in a line that long might not be able to vote the way that they planned on voting. So when we're talking about making a plan, make that first plan your ideal plan, and then have a second plan, right? Have your backup plan, especially for folks who might have disabilities that prevent them from standing in lines for a long time or waiting a long time. If you can and you're able, I would recommend taking a portable chair if you have that as an option, if standing is a difficult thing for you. If you can go in a group, so that there's some way to check in with folks, of course, wear your mask, stay distanced. But if you want to and it feels safer for you to do so, definitely go with a group, find your people, get connected with them. But always remember that, this is a thing that we should be exercising. It's a right that we have. It's definitely a way to have your voice heard. It's not the only way. It's absolutely not the only way to do so. And we recommend you staying engaged on election day, beyond it, before it, all of those things. But this election is extremely important. So definitely get out there and vote. Make that plan and execute it.
And absolutely. That fan, if you're menopausal, take that fan too.
I love it. The one thing I would add as the last kind of the closing salvo on making a plan, take someone with you. Even if it's an underage child, take them with you. That's something that I remember going to the polls with my grandmother and my mom growing up. And they instilled in me the importance of voting. And so they actually took me into the booth with them to vote. And so take them with them. Show them, kind of the breadth of how important it is to vote. Because this is truly an election of a lifetime, of a generation. And so we want to make sure that our voices and our votes are tabulated properly. So one thing I do want to mention, because I don't think we're going to come back with it later, is don't expect to know the results of the election on election night. It is completely okay that we will not. And the reason is so many states, because of COVID, have had to implement huge voting by mail operations. And certain states have parameters on when they can and can't count or tabulate votes. For example, the state of Florida can tabulate those votes that they received by mail prior to election day, whereas the state of Pennsylvania does not. And so you're dealing with, you're already going to be dealing with very, what we're expecting to be huge turnouts on election day, plus them if they're not able to tabulate those votes before election day. So they're having to tabulate that too. So it's completely fine, no matter whatever the naysayers say. It is completely fine to not know the winner. What's important is that we want to make sure all of the votes are tabulated. So that's all I have.
Thank you for saying that, Tim. And before we continue, I want to jump in and say, we know that there are questions coming in the Q&A. Keep them coming. We're going to try to answer them today. If we don't get to answer them during the program, we will provide the answers in the email that follows. So keep them coming. We got a lot of ground to cover.
We do.
So let's move on into the fair tax.
Yes. Okay. So one of the questions, if you are in Illinois, one of the questions that you're going to be seeing on your ballot, actually the first question on your ballot, is about the fair tax. Now, I know you may have seen ads about it. You may have seen commercials with conflicting information. You don't know what's right, what's wrong. So here we are to set the record straight about the fair tax, y'all. AFC supports the fair tax. We suggest you vote yes on the fair tax for a number of reasons. But let me just break it down for most folks here in the room watching, right? 97% of Illinoisans will have a tax cut or pay no more than they do now for their taxes. This is an income tax change, okay?
Say that again.
97%, okay? That is probably everyone listening, unless we have some secret millionaires and billionaires on the phone with us. You all will be receiving a tax cut or pay the same amount that you paid for income taxes in previous years. This question will change the Illinois Constitution. It will be an amendment to that Constitution to allow us to not have the flat tax rate that we have now, but a graduated tax rate that is adjusted based on your income. What that means is that if you are making more than $250,000 a year, you will probably have a little bit of a higher tax, right? That higher tax on those folks means that we will raise more than $3 billion to fund state and local governments, schools, human services, all of these different resources that we all access and need. So what this means, and I know that I've seen a few commercials, I have been very upset when I saw them. I saw a couple commercials where they found folks who, they'll put the person's name up there, put their face up there, and they'll say like, so-and-so, single mom. And then she'll say, why should Springfield take more of my money? Now, unless the single mom is a billionaire or a multimillionaire, she actually won't be she won't have to worry about Springfield taking more of her money. She's not going to be impacted in that way. And there are a lot of these statements in this commercial that say that this is going to hurt small businesses. It's going to, it's just a way for politicians to take more of your money. That's actually not the spirit of this amendment. This amendment is being used to make sure that we're generating revenue for our state to help fund all of those services that we all use and we all need. It is the fairest way for us to use our taxes. It's also a much more equitable way. So folks will point to a flat tax and say that that's equality, that that's what we should be doing because everyone pays the same percentage, but we're not all making the same amount of money, right? And we need to move away from the conversation of equality and towards the conversation of equity, right? What we need to do is make sure that folks have their needs met, and all those needs are different. So raising or voting yes on the fair tax, raising this additional revenue for the state will, one, provide additional resources for the services we already know about, but it will also help us to combat things that come up like the COVID-19 pandemic, where we're going to have a multi-billion-dollar deficit in our state. So having these additional funds will help us balance out that deficit, help make sure that you and I are able to continue to do the things that we need to do, that our schools are funded, that our roads are funded, that our health systems are funded, and that we're all able to access those resources. So when you think about equity and you think about fairness, this is why you should be voting yes. It's the very first question on your ballot. I was very excited to see that it was the first thing to fill out. Vote yes, you all. It will do wonders not only for us, but for every single Illinoisan. So please vote yes for the fair tax.
And I'm glad you brought up COVID in this context, because in a normal year, we need this revenue. But as you point out, COVID has wreaked havoc on all budgets, all of
Absolutely.
them.
Hmm.
There's just very little revenue coming in. So that makes that the fair tax, voting yes for the fair tax, even more important this year.
Yep.
So, so let's shift gears a little bit away from Illinois and move into an area that, yeah, has us all in our feelings right now. Um, Lots of federal updates, but starting with SCOTUS, the Supreme Court of the United States.
Yes.
What do
Let's
you
get
have to
into
say about that, Aisha?
I have a lot to say, y'all, and we didn't put at the end. I
What do you
remember
have to
last
say that won't mess with our ability to continue to live stream?
exactly. So the funny thing is that we had this at the end last time when I was running through it, but we have it right in the middle today. And like Kim said, I'm feeling very Drake. I am in my feelings about the Supreme Court right now. As we all know, Amy Coney Barrett was confirmed this week. That is something that we've all been talking about. We've all been wondering what that means. It is a very concerning situation for us, especially because we have seen what her record looks like and we've heard some of her previous statements. And so when we're thinking about the very important cases and very important decisions that have come down from the Supreme Court in the past 5-10 years, it's something that we are definitely going to be monitoring and seeing how her vote will change or affect those decisions if they're brought back. So the first one, the big one, the one that is set to be heard on November 10th is California versus Texas, the ACA case. We know that Amy Coney Barrett seems to be along the more conservative line and will likely vote alongside the conservative justices that are already sitting on the bench. What that means is that we're very concerned about what's going to happen to the Affordable Care Act come November 10th. Again, I went through this a lot last time we had this conversation. I'm not going to go into as many details about it, but I just want to remind folks that Illinois is one of the 17 states that are defending the Affordable Care Act. 4 additional states joined the ACA defense on appeal, and 8 states have filed amicus briefs defending the Affordable Care Act. Unlike in previous instances when the Obama administration was in office, the federal administration is not supporting the Affordable Care Act. They are not defending this. So that's a very big shift from the Obama administration. Again, this is a challenge on constitutionality. So what that means is that if the Affordable Care Act is declared unconstitutional, there is a chance that the court could rule to basically state that the entire act is unconstitutional, or they can use severability, which means that they basically cut out the part that is considered unconstitutional and figure out or turn it back over to Congress to figure out how to make it work without that one unconstitutional part. So our hope is that none of it is declared unconstitutional, right? But if there is a middle ground, I guess the middle ground is that severability option where we see one part may be stricken. But if we do lose the Affordable Care Act, we could end up having, in Illinois alone, 1.15 million people without health insurance. That is an uninsured rate jump of 128%. We could lose $4.2 billion in federal health care, and that's 47,060 jobs lost, which is about 7.8 out of every 1,000 jobs. Like we said earlier about the COVID-19 pandemic, so a lot of these numbers have been calculated based on information before this pandemic started, right? So these numbers are really thinking about that. But when you factor in the effects of the COVID-19 pandemic, when folks are losing their health insurance, when folks are losing their jobs, these numbers can be exacerbated significantly. So as we're seeing another spike in cases in Illinois across the country, this is extremely concerning. And the fear of losing options for healthcare right now should be something that we're all thinking about and talking about. So if you have any other questions about the ACA, please feel free to add them. I'm going to move on to other things, but we have more details if you want to get into it. But to respect time, we're going to keep it pushing. Another thing that folks are thinking about with our new justice is marriage equality, right? So we already saw a very concerning couple of statements coming out of the Supreme Court before Amy Coney Barrett was confirmed, but now that she's going to be on the bench, There's even more of a concern for a lot of folks around marriage equality. Now, before I even go any deeper into this conversation, I want to remind folks, right? Before these decisions happened in this country, we had people in each of these different populations, right? There have always been queer people in America. There have always been trans folks in America. There have always been people who need access to care. Reproductive health rights have always been a concern. People have made it, they've survived, they've fought, they have kept up with all of the work that's been going on, and we will continue to fight. What we're talking about right now is what is there as a protection and what might happen to that protection. Don't ever think that we're going to stop fighting, though. Like, it doesn't matter what happens. It doesn't matter who's confirmed. It doesn't matter what happens on November 3rd or beyond. We're still going to be here fighting. So I just wanted to state that caveat, because I know a lot of folks are getting very discouraged and very worried. We have folks that we know. We have elders in the community. We have folks that we've known who are not with us anymore, who have been fighting, and we're going to keep fighting. So while you're hearing all this news, just remember that part, okay? So when we're talking about marriage equality, the case that we want to keep in mind is Obergefell, right? Obergefell has been challenged a couple of different times. And so far, we've been able to maintain marriage equality across the country with a new justice who is more of a conservative leaning justice. There is a concern about what will happen if it's brought again. Additionally, Amy Coney Barrett's track record on employment discrimination is another concern that folks are having, especially given the fact that she has ruled in cases stating that, for example, just the use of the N-word in a work environment does not make it hostile. So just, right? So that's the thing that is concerning about what is being said. It's this threshold of what is deemed hostile, right? And as a Black person, I'm just going to go ahead and say it. I feel like that would make something a very hostile work environment if anyone is allowed to use that language in relation to me or any of my colleagues or just in general conversation. So
absolutely.
Yeah, we have to definitely monitor what's happening with employment discrimination. Additionally, we've had 2 cases just this year that were decided for employment discrimination in regards to protecting LGBTQ folks, especially trans and non-binary folks. We're going to keep our eye on that as well to make sure that we don't see a rolling back of those protections. Another conversation that we want to have is around reproductive rights and access to that kind of care. I know a lot of folks have been talking about Roe v. Wade and what that means for abortion access. That is something we're definitely going to be looking at. We don't have any cases lined up right now to challenge these things, but don't worry, as we continue to have these fireside chats, we'll be monitoring what happens at the Supreme Court and keeping you updated on all of that information, okay? But in a recent decision that we definitely want to chat about is these quick voter turnaround cases that have been coming up with the Supreme Court deciding on them. Last week, the Pennsylvania Republican Party petitioned the Supreme Court to strike down a 3-day extension of Pennsylvania's deadline for mail-in ballots to be received in order to be counted. This came just a few days after the Supreme Court declined to issue an emergency ruling putting these extensions to hold. So this case from Pennsylvania was joined with cases from Wisconsin and North Carolina about how ballots are going to be counted. Like Tim just mentioned earlier, what does it mean? What dates, like what is the cutoff date and all of that? So in a 5-3 party line vote, this was decided before Amy Coney Barrett was confirmed. I think it was decided maybe hours before she was confirmed. The Supreme Court rejected Democrats and voting rights groups' attempts to reverse the Seventh Circuit, putting the brakes on a district court order that would have extended the deadline for receipt of absentee ballots postmarked by election date and received for up to 6 days after election day. What that means is that, for example, if you got your ballot postmarked on November 3rd, but it was received by your Board of Elections on the 6th, it might have been able to be counted, but with this ruling, it can, that extension is not going to be permitted. So this is why earlier when Tim was saying, find out what your plan is, get things in as soon as possible. This is why we're saying that dropping the ballot off in those sealed ballot boxes is the best course of action right now. We don't want there to be any issue with USPS delays. And this is, of course, us not blaming the USPS, right? We're not blaming the US Postal Service about this delay. We understand what has been happening. But with that delay, given and given the huge turnout that we've already seen with mail-in ballots and absentee ballots, driving that ballot or getting that ballot somehow to one of those ballot boxes is the safest way to make sure that your vote is counted, okay? This is one of those cases that is really concerning, especially in conjunction with the cases that we mentioned in our last fireside chat, where you see states trying to roll back different options for voting and these constant attacks on the Voting Rights Act. Our goal is to make sure that we share the information and keep track of these things, and we'll keep you all posted with how that's going. If there's any update around that, we'll definitely let you know. But that's the only thing we have for the Supreme Court. I'm going to open it up to my panelists to see if there's any additional comments before I move on to our COVID package discussion or update. We good? We good? All right. So let's talk about another federal topic that everyone is definitely interested in hearing about. We need to discuss if there are any COVID packages coming, and in a frustrating turn, Mitch McConnell, our majority leader right now, Mitch McConnell, called a recess for the Congress, the federal Congress, until November 9th, meaning that from now until November 9th, our representatives are not going to be hearing anything about any COVID packages. As a reminder, there has been a COVID response package waiting to be approved from the House Democrats since May, okay? The HEROES Act, the first iteration of the HEROES Act came out in May. That was 5 months ago, y'all. So even after that was rejected by the Senate, the House went back, the Democrats went back, they reshuffled it, they lowered the tag on it, they dropped it from about 3 trillion to about 2 trillion, which is a huge gap. And in that updated HEROES Act, there would have been $10 billion towards supplemental nutrition access program, $400 million additional dollars for women, infant, and children programs, $450 million for the emergency food assistance program, $900 million for tribal government needs necessary to prevent, prepare for, and respond to COVID-19, which is extremely important because Indigenous populations have been hit significantly harder than a lot of other populations. $249 billion for health and human services to support public health, research, development, manufacturing, procurement, and distribution of vaccines and therapeutics related to COVID-19. There would have been $100 million for Ryan White clinics, $65 million for housing opportunities for people with AIDS, $13.7 billion for the Centers for Disease Control, and $8.5 billion towards Substance Abuse and Mental Health Service Administration. So that was even after all of the cutting that happened to the initial version of the HEROES Act. Additionally, the Senate Republicans put out the HEALS Act, which was broken up across multiple bills and did not allocate as much funding towards the supportive services. There was no provision in it no anti-discrimination provision put into there, but there were line items to increase the funding available for corporate lunches and also to build a new FBI building in DC. And as somebody from DC, I can let you know, we don't need a new FBI building in DC. So there was no reconciliation between those two plans, and right now it doesn't look like there's going to be anything that we'll see before, well, definitely not before the election, but possibly not before the next year. So we might be looking at a 2021 COVID response. I wish I had better news for that, but right now that's kind of where we are. We also mentioned in our last Fireside chat the executive order around trainings, anti-racist or different versions of discrimination trainings. That executive order applies to 5 different groups. That applies to federal departments and agencies, the military, federal contractors, federal grant recipients, and potentially all employers in the country. So nonprofits could fall into one or more of those last 3 categories, including organizations like AIDS Foundation Chicago. That executive order would prevent government contractors and contracts entered after November 21st from providing, and this is a direct quote, any workplace training that inculcates its employees on race or sex diversity, equity, or inclusion involving what are considered divisive concepts. So grant recipients also have a little bit of time. So November 21st is the deadline for federal agencies to report to the office, to OMB, all of the grant programs for which the agency may require the recipient to certify that it will not use federal funds to promote these quote unquote divisive concepts. These forbidden concepts that are deemed anti-American and divisive by the administration include anything that might make someone feel, quote, discomfort, guilt, anguish, or any other form of psychological distress on account of his or her race or sex. An example that they offered was workplace diversity trainings that suggest that men and members of certain races, as well as some institutions, are inherently sexist or racist. Now, if you've been following AFC, you know that we've been talking about systemic racism and all the things that have been happening. about the different ways that healthcare access has been impacted by racism, how equity across the board has been impacted by racism in this country. We also talk about sexism, we talk about homophobia, we talk about transphobia. And this executive order would make it more difficult for any funding or any program with funding from the federal government to include language like that. So to give you another example, in this Fireside chat, right, we would have to be cautious. If this Fireside chat was funded by federal dollars, we would have to be cautious about how we discuss the ways that race, sexual orientation, gender identity, gender are impacted by any number of things, right? We would not be able to talk about privilege. We would not be able to talk about white supremacy. We would not be able to talk about all of these things. In addition, it would limit the ability to talk about things like intersectionality. It would have an impact on us talking about systemic racism, critical race theory, racial humility. All of these terms were actually marked in a memo from OMB to heads of executive departments and agencies. I'll get the link for that to you all in the chat. But in that memo, there was a number of different caveats and a lot of guidance that was given out. I'll let you all read through that at your own leisure if you would like to. But importantly, it required that all of these federal agencies list out and share information about every training program related to diversity and inclusion held during fiscal year 2020, and include those trainings that are conducted both by the agency's own employees as well as those conducted by others. It also means that federal awarding agencies were required to report to OMB through different offices the programs for which the agency might impose the conditions identified in Section 5 of the executive order. So that means that all of these agencies had to list out grants that would be received by different organizations that would be governed by this executive order. To give you a direct example, if AFC were to receive a grant from a federal agency, like USDA or HUD or anything like that, we would have to be listed on that list if that training from that funding would discuss any of those topics. For AFC, because we have priority populations that include people experiencing homelessness, Black and Latinx community members, queer and trans community members, that would put a very serious strain on any kind of conversation that we would be able to have. So that's just a way for you all to kind of relate it to what we're talking about exactly. And then let's see. I think that might be everything about the executive order to share right now, but as more things develop and as we see more guidance coming out about that, we will definitely keep you posted and updated about what that executive order means and what we can do to either combat it or figure out ways to work around it.
Wow. That was a lot. Thank you for going over all of that, Aisha. And also, thank you for the reminder that we're fighters. We're going to keep fighting. There's a lot at stake with every election, and no matter who is elected, we're still going to have to keep fighting. So that was a good reminder, especially to folks who are feeling kind of down right now. Overlaid by COVID, which has us already feeling all kinds of things that we probably don't even know yet. So now let us move to all the things happening at the state level. And for that, we're going to turn it over to Tim.
Okay, I'm having my daily fight with the mute button. I'm sure we all are in these Zoom days. Yeah, thank you so much, Kim. There are a number of different things going on kind of in the state. The state General Assembly will be going back into session for veto session November 17th through the 19th and December 1st through the 3rd. Those are the scheduled dates right now. One of the big things that is on the docket is criminal justice reform, which I will touch on that in just a moment.
Before you go there, can you explain what veto session is?
Sure. Thank you. That's good thing. Veto is generally a time where the General Assembly convenes again, usually late fall, to reconsider bills that may have been vetoed by the governor. Generally in a normal year, which 2020 is not, you would have the end of the regular session, which would end in late May, early June. And then the governor over the summer into the early fall would have time to veto any bills that he saw fit to. And so then the General Assembly would have this fall veto session, to come back and attempt to override a veto. Basically have the votes necessary to override that veto, and to send whatever riding the veto into. However, this year there are no bills that they're vetoing as of now. Not that I've been able to see. So that's kind of what they're doing. And so this year, for veto, they will be focusing mostly on criminal justice. But there are a couple of other things that are related to, especially one thing that's related to the fair tax that Aisha mentioned, and that is the state budget. Right now, we understand that the state was in a budget hole pre-COVID, but of course that has been made very, much larger after the budget was passed back in May. The state had about a $6 billion deficit. They were able to sell back some bonds at about $1.2 billion, if I'm not mistaken, earlier this summer. And so they got that down to about $4 billion deficit. And so if the fair tax does not pass, and Aisha mentioned basically the fair tax passes, it would infuse $3 billion into the state's coffers. Well, if that doesn't happen, general rule of thumb is that the state will borrow from the federal government that money in order to cover that deficit. And then what you would look at is, for the 2021 budget discussions, they would be looking at a lot of, drastic cuts to a number of services. And so that is definitely something to kind of keep on the back of your mind, that this fair tax is really kind of one of the things that the state is hanging their hat on. Another thing that the state is kind of hanging their hat on is a possible influx of cash from the federal government in terms of some type of stimulus to the state government that would be able to close that gap and deficit. So something to just kind of keep mindful of. But for veto, one of the big things they're talking about is criminal justice reform. Of course, in light of the killing of George Floyd back in late May, and kind of the civil unrest that we've seen over the summer, and even right now as the protests go along in Pennsylvania following this latest case. The General Assembly has been meeting over the summer and the early fall with a number of subject matter hearings over a number of different issues. And they had one yesterday that was actually on police reform, which was very enlightening. Basically, just to kind of talk about the Legislative Black Caucus, their policy agenda is really kind of based on 4 pillars, one of which is criminal justice. And so that's kind of, a big overarching thing. The governor also earlier this month released his 7 guiding principles to building a more equitable criminal justice system. And both of those from the Legislative Black Caucus and Governor Pritzker, they overlap a lot. And so just to kind of to talk about criminal justice reform, violence reduction and police accountability, a need for ending mass incarceration, enacting police reform, strategically investing and redirecting state funding to reduce violence in Illinois communities. Some of these, strategies look like ending the state's cash bond system for those awaiting trial, rolling back mandates that those convicted of certain crimes serve a part of their prison sentence, so mandatory minimums, reducing penalties for those convicted of drug crimes, enact policies that would limit an officer's ability to use force, more training on crisis intervention, transparency and police data, and holding police officers accountable for bad actions. And so yesterday's hearing, they touched on a lot of these points. And so I do want to kind of go over some of those, because I know we're kind of pressed for time. Several bills have been filed on a number of these, and I'm going to go over 4 of them. HB 4796 would basically, those in police custody have the right to communicate with their attorney and family as soon as possible, within no later than 1 hour after arrival at their first place of custody. Those in police custody must be given access to a telephone to make at least 3 calls. And I know when I first saw this, I was like, that's ridiculous that we're having to pass a law that obviously you're supposed to be afforded these rights. And so sadly, we're having to talk about, codifying something that should be done already. And so that's HB 4796. Representative Justin Slaughter is the sponsor of that bill. Then we have 3 that have been filed by Representative Carol Ammons. HB 2111, a law enforcement officer who knowingly fails to turn on their officer-worn body camera or knowingly turns it off is a violation. It's a Class 3 felony, and of course they would be fired. And so that's one law that piece of legislation they're considering. HB 2112, again, Representative Ammons, a law enforcement officer who knowingly misrepresents facts describing an incident in a police report or during an investigation is a violation, and it's punishable with a Class 3 felony as well. And so again, they're trying to get to the heart of police misconduct. And then finally, HB 5830, Representative Ammons as well. They talked about yesterday during the subject matter hearing the collective bargaining agreements. A lot of times what we run into is that it's very difficult to put in transparency and accountability measures because of a lot of the parameters that are put in place in the contracts through collective bargaining agreements. And so HB 5830 says provisions in police officer collective bargaining agreements that do not pertain directly to wage or benefits are to be declared against public policy and unenforceable. What that looks like is, if this passes, this is basically saying if it does not include wage or benefit, nothing else is supposed to be in collective bargaining agreement. And so that's big. This piece of legislation also says anyone filing a complaint against a police officer must have the complaint supported by a sworn affidavit. They're basically getting rid of that, because right now you have to have that complaint, supported by a sworn affidavit. You no longer have to do that if this legislation is passed. And then also it would delete a provision that in the course of any interrogation, no officer shall be required to submit to a polygraph test or any other drug test questioning, except with the officer's express written consent. And so this goes to kind of, making sure during the investigation of officers where misconduct has come into play. And so, again, we want to make sure that through this legislation, Representative Ammons rather kind of deleting that provision from those collective bargaining agreements. All of those things are in collective bargaining agreements. And so that's what this that bill HB 5830 is looking to tackle. There are others, but these are some of the big ones that they mentioned yesterday. Let's see. And then there's one final thing that I do want to touch on that not exactly sure if it will be talked about during veto, but will definitely be a subject moving forward into 2021, and that's telehealth. We have seen during COVID-19 the need to make sure that clients still have access to their providers, and we've only been able to do that through telehealth. In our conversations with stakeholders and whatnot and providers, telehealth has been a huge issue that has come up in all of our policy priority development process. And so AFC recently joined the Coalition to Protect Our Telehealth. And basically, we are looking at pushing legislation in 21 that will provide coverage and payment parity for providers for telehealth, allow patients to access those telehealth services anywhere, including their home, as well as provide maximum flexibility when it comes to technology in accessing those telehealth services. And so we're looking forward to working on that legislation. And so with that, I think that's about all.
Before we move on, just to like add a little cherry on the top of that lovely Sunday that Tim just laid out, when we're talking about these collective bargaining agreements and also this telehealth provision, what we're talking about is also just taking down some of the barriers that have been in place to achieving equity, right? So like when you think about all of the things that Tim was mentioning that are often included in collective bargaining agreements, those are things that have been put in place to add additional layer of protection for officers and law enforcement, right? And that can feel kind of counterintuitive when law enforcement is supposed to be here to make sure they're protecting us, right? So to try to protect the protector from the people being protected, it just isn't, it can cause a conflict of interest, right? And it plays out in requiring things like a signed sworn affidavit. If I walk in the street and ask any 10 people randomly about how to fill out and create a signed sworn affidavit, I guarantee most of them won't be able to tell me how to do that, right? So just removing those kinds of barriers from accessing either health or equity or any kind of protection in that way will make it so that everyday folks who aren't policy experts, right, are able to navigate these systems in a much easier way.
Aisha, you have the mic for the next section too, so go ahead in there. Oh, hold on.
Just one more thing. I do. Yeah, just one more thing before Aisha kind of closes us out. I mentioned, of course, the criminal justice reform package. They're looking at doing an omnibus package, which basically means a large bill with a lot of different things in it, kind of simply. But then they do have 3 other pillars that they want to work on: education and workforce development, economic access, equity, and opportunity, as well as healthcare and human services. And so from my understanding, they're going to be addressing a number of those issues kind of moving forward into 2021. So I'm done.
All right, there we go. So back to me, we're going to talk a little bit about some local updates. Today, actually, our local update is just on one topic, and it's right in the lane of healthcare accessibility. So as I'm sure a lot of folks in Chicago are aware, the announced closing of Mercy Hospital and Medical Center in 2021 has been a very big conversation that folks are having. So for folks who don't know, Mercy Hospital serves residents of the South Side of Chicago, which is a community that has long faced inequitable access to healthcare options, while also being disproportionately impacted by many healthcare struggles, including the COVID-19 pandemic, access to care related to HIV prevention and services, telehealth services, mental health access, maternal or parental pregnancy mortality and morbidity, all of these things, right? So we have a higher instance of those issues, in addition to the other ones like hypertension or high blood pressure, diabetes, heart disease, all of that. So losing Mercy Hospital will increase the inequitable access to healthcare for Black folks on the South and West sides of Chicago, right? What that also means is that, you know, it's a furtherance of historically Black neighborhoods that rely on these kinds of institutions being placed in what's considered like a healthcare desert, similar to a food desert. Being in a healthcare desert means that it is very difficult for you to access care either close to your home or in a way that is like comprehensive for you and your needs. I will also point out that that Mercy Hospital has been around for about 170 years now. So taking away an institution that's been around for almost 2 centuries is not only just harmful in terms of healthcare access, but it also shows the way that these communities are not being invested in. So in the city of Chicago and across the nation, we know that Black communities often experience significantly worse health outcomes than their white neighbors. This trend has existed for decades, and it's not because these communities are less healthy, right? What we don't want to do is pathologize communities of color. The issues that are faced by these communities disproportionately are a result of systemic racism and a lack of access to healthcare. so in the city of, so I'm sorry, I already said that part, but the disparities are like both the result of and are exacerbated by systemic anti-Black racism that exists throughout our society and in our healthcare arenas. And Mercy Hospital, being one of Illinois' 40 safety net hospitals, also provides services to folks with no or low income and uninsured patients who are seeking life-saving care. So this means that Mercy Hospital works with a large number of patients that are covered by Medicaid and Medicare. Three really big important areas that Mercy Hospital also provides specialized services for in this predominantly Black neighborhood are care for people living with HIV, substance use support, and assistance with birth, so a very serious gynecological practice. I've been working on my language around these medical terms, y'all, I'm trying. So for people living with HIV, connection to care is imperative to maintain health and quality of life. Mercy Hospital's Michael Reese HIV care program provides care to approximately 400 patients and provides clinical services, including comprehensive primary and specialty medical care, prevention and risk reduction, case management, and medical adherence counseling. In addition to care for people living with HIV, Mercy Hospital provides substance use and addiction services to Black communities that have been unjustly targeted by racist drug laws for years. In August, also, the Chicago Department of Public Health released a report showing that Black Chicagoans made up 60% of deaths related to opioid use this year, which is a 66% increase in the rate of fatal overdoses for Black Chicagoans compared to last year. So they looked at January to June of 2020 and compared it to January to June of 2019, and there was a 66% increase in these deaths. Finally, we must note that closing Mercy Hospital will result in the loss of reproductive health care services, including obstetrics, and in a predominantly Black community that is extremely harmful. Last year, the Chicago Department of Public Health also released a data report on pregnant parental morbidity and mortality as part of the Healthy Chicago report. And Black women have the highest rates of severe maternal morbidity and the highest pregnancy-associated mortality ratio in Chicago. This report also concluded that, quote, stark racial and socioeconomic disparities in maternal morbidity and mortality exist in Chicago, especially among Chicago's non-Hispanic Black mothers and those living in communities with higher economic hardship. So hearing that Mercy Hospital is closing is something that is extremely concerning to all of us. It's something that we definitely have to take note of and really think about what that will do to the landscape of healthcare access and equity. So we have some information about Mercy Hospital. There is a sign-on letter going around for folks to really speak out against the closing of Mercy Hospital. And there are going to be some virtual hearings held both today. Well, no, the virtual ones are tomorrow and Friday. There's an in-person one happening, I think, right now. But you can register for the virtual ones tomorrow and Friday and submit a comment, either verbally or a written comment. We can share that information with you as well. But definitely speak out, let your voice be heard about this very important issue. And that's it for me.
Wow. Once again, we have shared a lot of information in this hour, and I know that we leave the videos up on our Facebook page, so if folks need to get a refresher, it's available there. Also, we share the link when we send the thank you email out. So I want to thank Aisha and Tim for the wealth of information they've provided. Also to our background crew, Meg and Jack, moving on the questions and the fireplace. I want to remind folks, as Tim said, make a plan, execute that plan to vote. Election day is November 3rd. If all else fails, get to the polls on November 3rd. Take your fan and all the other things that were mentioned. Be on the lookout for the information about Mercy Hospital and how you can help support that effort. Also, if you vote, remember AFC is in support of the fair tax, and we encourage you to do the same. And we are going to bring the next Fireside Chat to you on November 20th. It'll be after the election, and we process all of our emotions and have the words for all the things that are going on. So thank you once again for joining us, and we will see you next month.